With maternal or postnatal depression on the rise, KK Women's and Children's Hospital is now screening expecting mothers for signs of depression as part of their routine pregnancy care. This is so they can detect and treat the condition as early as possible. Sherlyn Sia tells us more.
For 38-year-old Diana Rahmat, her 10-month-old boy is the newfound joy of her life. But her journey to motherhood wasn't always smooth sailing. Just a few weeks into her pregnancy, Diana began to struggle with depression.
The greatest concern was knowing that I had mental health issues before, whether that is going to be something that will be passed on to my child. And I think that was one of the largest reasons why I was afraid to continue the pregnancy.
She sought help from doctors at KK Women's and Children's Hospital. Their early intervention through therapy and counselling gave her a lifeline and helped her manage her fear.
So in any moments where I have any mental health situations in terms of coping with motherhood, because that will affect how I am towards my child. And the treatment really helped me to remember how I should react or assess the situation.
KKH is the first hospital in Singapore to introduce the screening program to help detect antenatal depression that occurs during pregnancy. They expect it will benefit about 12,000 patients every year. The move comes in light of rising maternal depression rates in Singapore. The hospital says antenatal depression affects 1 in 5 expectant mums today. Left untreated, it can lead to postnatal depression and affect mother-child bonding and the child's brain development.
Pre-COVID to post-COVID, we saw a 47% increase when we screened our patients for postnatal depression. So this made us think that patients with antenatal depression were going to need some help as well.
The screening process is part of a routine checkup in a patient's second trimester. Patients fill in a survey asking them about their emotions and then discuss the results with their doctor.
The obstetric doctor will recommend a referral to either a psychiatrist or to a clinical counsellor, depending on her score. And then if we look at those with the higher scores, they see a psychiatrist who will do a history and a mental state examination to arrive at a diagnosis for each patient and also to advise them about the severity of their condition.
Patients with more serious conditions may be sent for routine counselling or psychological therapy or prescribed medication like antidepressants. Regular checkups may also continue after childbirth as needed.